gas plate, excuse me, a big plate up here with 4 screws now, holding it together. So,
Really? Oh, man.
man, let's just
Well,
hope this works.
good to see you.
Good to see you. Good to, oh, I see Greg Poshman's on here. Hi there, Greg. So we have Billy, we have Tori, we have Karen, and I know Linda's trying to come in through her computer. We have 2 people who will not be here today. Jeannie Siebold is in an all-day workshop or all-week workshop, and then Brent Miller has chosen to get on a plane and go somewhere. I called him Braveheart. Okay, we don't have quorum yet. There's Dr. Levin. Okay, Josh. I hope we see everybody's pretty face. Come on, Karen. Karen, come on. We need to see your pretty face. Tom Dunlop, my old neighbor. Now there's Tom Kurt. Good to see you, Tom. Okay, we are at 1, 2, 3, 4, almost 5. We're not, do we have quorum now, Karen? I think we do. No? There's 4 people of the board.
Bill is an alternate for you, Markey, so I think we need, oh, Linda's back. Yes, yep. We do now. Mm-hmm.
We have quorum, and I do want to welcome everyone to this board meeting. It's 1 o'clock, and the agenda is very, very busy today, a lot to be discussed. And with that said, I want to thank Suzuho for putting together the first draft of the agenda. She did an awesome job, so thank you very much, Suzuho. And we do have quorum. I've got a dog bugging me here who wants to get petted. So if I'm moving this way, it's because this big golden retriever is bugging me. So let's look at the minutes of the previous meeting and see if there's any corrections or additions. And if not, do I have a motion for approval? Tom is motion to approve. Do I have a second? Okay, Greg, thank you. All in support, just raise your thumbs. Okay, we're there. Okay, the next item on the agenda is a very important new development put out by the state, and it's called the Corona Meter Data. And I think, Karen, you're going to talk about it in our daily update. You want to lead us in, or are you going to talk about what the state put out in the next part of the meeting?
Yeah, I think what we were actually going to start with the traditional kind of data report from Dr. Levin and Josh, and then we'll move into the discussion around the state dial.
Okay. With that said, Josh, you want to dial it up?
Sure can. Thanks, Markey. Am I presenting, or is Lindsay pulling it up?
Who's first?
Oh, perfect.
There we go.
Perfect. So just want to go over some data that's coming out of Europe. So normally I've been focusing on just some other countries and what they're doing there, just to kind of inform our practices here. But have some concerning data coming out of Europe. So I decided just to lump them all together and talk about what's going on over there. So the WHO has warned of a very serious situation in Europe. They're seeing alarming rates of viral transmission. The graph on the bottom left there will show you what we're seeing. So for a while, the United States and the EU, we were very far off in case counts. We were seeing a lot more viral transmission than Europe was, as seen in that graph there. What you'll notice is right now in mid-September, we're converging, right? We're almost seeing the exact number of case counts between the US and the EU now. And the EU has been climbing since about mid-July, whereas we've been coming down since about mid-July. And so there's a lot of concern there about what that's going to mean for us going forward and moving into the fall. But there's a lot of reasons for why the EU is seeing this increase. One is they've had some issues with testing that have been noted out of England. just lack of testing and people feeling that they cannot get a test when they need one. And so that has led to a lot of individuals not going to get tested. And that's led to part of the spread there. So they've limited their group size down to 6 individuals across England. Spain is citing population density issues, saying that people are not adhering to distancing, and mask adherence and things are dropping as well. And so they're starting to see more cases because of their densely populated cities. Germany had a pretty large outbreak connected back to a Bavarian ski resort who's actually a US resident. So they went ahead and closed all bars at 10 p.m. and have taken several other measures to try to reduce the spread there, because this one case has really been linked to I think a few hundred now. So they're concerned there with that outbreak. Then Greece and Croatia, who are largely spared during the first wave, because of the increase in travel over the summer months from people all around the world, they're now seeing spikes in those 2 countries on the coast. So really across Europe, they're seeing huge spikes. Spain is actually seeing the most again. So they're of course concerned because of what they saw back a few months ago with their cases. But this is important for us to look at because we saw this early on. We saw the EU spike right before we did. If you look on the graph there on the bottom left, you'll see the blue line began to rise right before we did, and we kind of rose in tandem about 20 to 25 days later. So if this is what we're seeing in Europe, the question is, are we going to begin to see this in the US? So I just want to share that information and just kind of what we're seeing going on in Europe. Next slide, Lindsay. So then looking at our epidemic curve, I also included out of jurisdiction cases on here as well, just to kind of provide that additional context. These are only out of jurisdiction cases since July 8th. So there are more back in the months prior to July, but we just have those since July. So notice right around early September, late August, we began to see a lot more out of jurisdiction cases, and we've seen several recently, especially linked to Labor Day weekend. So we're dealing with 2 somewhat sizable issues right now with some out of jurisdiction residents. So not always going to be captured in our numbers, but it is taking up a lot of our time trying to ensure that we can mitigate that and prevent the spread of those mini outbreaks that we're having. One has, we have 5 cases linked to it. Another has 3 currently, but we're monitoring many more who are symptomatic. But those are all out of jurisdiction cases. So then if you look at the bottom here, I'm looking at our last 7 days, last 14 days, and last 28 days. If you compare this past week to the week prior, we've seen a doubling of cases from 4 to 8. Same kind of trend if we look at the 14-day cases, we're seeing a little bit more than doubling there. Our 28-day case counts have not quite caught up. So we still saw a substantial amount in August through and sorry, those dates are wrong there. We're looking at the last 28 days and then 28 days prior to that. But we saw 22 cases in the last 28 days. And then the 28 days prior to that, we saw 40 cases. So that one's still catching up a bit, but our more recent trends are showing that we are increasing in cases. Next slide. So this is our positivity rates by different age groups. So we broke it up 0 to 9, 10 to 17, 18 to 30, and so forth. And what you'll notice is that for the most part, the positivity rates are hovering around 5%. We have begun to see an increase in positivity rates among those who are 10 to 17. We have been seeing a lot more testing among that age group. So I think that's part of the reason why we're beginning to see this increase in positivity. And keep in mind too, that when our testing numbers are low, just a few cases can really increase positivity rates. So, with the 10 to 17-year-old age group, we are seeing more cases among that age group. But while we're seeing more testing, the testing is still not, as high as it could be. And so we're only seeing, tens of cases in that age group, whereas in the other ones we're seeing, closer to 100 or so. So I just wanted to keep that caveat in mind when we look at that number. It is significant and it is something that we should look at. But the testing data and the denominator there is an important piece to factor in as well. Next slide. Then this slide here looks at positivity rate by city and town. So we have Aspen, Basalt, Carbondale, and Snowmass. Snowmass includes town of Snowmass Village as well. So these are the positivity rates that we've observed there since the 26th of August. And what you'll notice is Carbondale had a pretty high positivity rate, and this is all of Carbondale. It's not just our section of Carbondale, it's all of Carbondale, just to kind of give you some perspective there. So we know that the incidence rate in Carbondale has been higher than in our other cities. That's been true for several months now. It has come down more recently, but you'll notice the yellow line there was beginning to decrease right around the 26th of August. Now we've seen it stabilize a bit, right around 5%. And then our basalt positivity rate has increased. So we have been seeing some more activity out of basalt. Their positivity rate is hovering close to 8.5%. Next slide. And then, just to touch back on our cases among Hispanic and Latinx community, we had talked about this about a month and a half ago when we were seeing pretty large increases in cases among that community. We've really seen that level out and haven't seen any new cases in that community in several weeks now. So all of our cases recently have been among non-Hispanic individuals. So, whereas, if you look back here in June, we weren't seeing too many cases there. So that's why it's so high, because we only had 2 or 3 cases that were reported there, and they were all Hispanic or Latinx. So that's why it's 100%. But then even throughout July, we had a pretty significant amount of individuals among that community who were testing positive as compared to the rest of the population. But that has really leveled out, and we're happy that those levels have gone down. And that there isn't as big of an impact right now in that community. Next slide. And I think the last slide that I wanted to share real quick, I know the agenda is packed, so I tried to keep it short. We began working on our long-term effect study and follow-up. So we are following up with all of our cases 6 months out from their original diagnosis date. And we're trying to understand what kind of long-term effects they may be experiencing at the 6-month mark. So we just started it. We've only done a few interviews so far, but that is underway. We're shooting for an 80% response rate, if possible, among all of our cases and EpiLink cases, or PCR positive cases and EpiLink cases. And then we're also going to reach out to some of our IgG positive cases as well. These are individuals that we have not spoken with previously, but we are going to reach out to them to try to understand how the virus has impacted them as well. So that one's going to be a little trickier because we're not going to know exactly when they were sick, but we still want some data from them to try to understand what they're experiencing. So I have received several emails, and I know that there's some concerns out there in the community that, just because we weren't PCR positive or we're not counted in your statistics doesn't mean we're not troubled by the complications that we're experiencing. So we are reaching out to those individuals as well. So I just wanted to update the board that we are doing that. And, once we start getting some preliminary data in, probably in 2 or 3 months, then, we'll be able to kind of share what we're seeing. I think that's it for me, Lindsay, unless there's another slide that I forgot about. Nope. So I'll pass it over to Kim.
Yeah, thanks, Josh. Thanks for that. I'll just talk briefly today and present the hospital data. And as Josh pointed out, there has been an increase, a doubling in the number of cases over the last week versus this week from 4 to 8, and then the increase in out of jurisdiction cases. And just to remind everybody, these out of jurisdictions cases are not, if you're following the dashboard online at the public health website, the 208 confirmed cases, that those cases are not counted in that. So things are counted differently, and just keep that in mind as you look at the data. So this is the AVH matrix. Current status is comfortable in all 3 levels: inpatient, daily visits in the ED, the respiratory evaluation center, community testing, and then the healthcare workers. We are comfortable, and I'm going to show you some data that is showing that we are watching this very, very closely. This is a 14-day average that sets us in a status. So the next, which we were in cautious in July, and I know we're back in comfortable now, but we really are on the brink of going from comfortable to cautious. And I'll show you some of the data that is doing that. And I think this is likely confirming the expectation that from the Labor Day weekend that we would expect an increase in cases, and I think that is what we're seeing. And it's continuing to rise, so we're just watching it very closely. So next slide, please. So this is the inpatient that we did have one inpatient, I think discharged yesterday, COVID positive. But again, we are in the comfortable phase in that we are below our 8 cutoff. Next slide. So the emergency department visits have been a little bit concerning. You can see that they have been on the rise kind of since the middle of August. And now there's a sharp increase at the very end, which I think again is this this kind of warning that we're seeing more sicker patients from COVID with COVID-like symptoms in the emergency department. And we've gone above the 6 daily of that would put us into that cautious zone, but we haven't averaged that over 14 days. So that's what this is the data that's important in terms of we're seeing a lot more activity in the emergency department for COVID-like symptoms, but we haven't averaged yet to put us in the cautious zone. And we'll see what this very last rise up, if where that trends. Next slide. For the community testing, this has also been a concern. You can see that we've gone over many times over our limit of 16 that would put us into the cautious zone. I think here is where we're really on the very brink of saying, hey, we possibly go over the edge and go into cautious at any point. But again, I think this just speaks to the overall picture of an increase in cases, an increase of out of jurisdiction cases since the Labor Day weekend, and an increase in emergency department COVID-like symptoms as well. So just kind of an overall increasing trend since Labor Day weekend. Next slide. And this is a slide for employees that have been out, and there's no employees now that are out with COVID-like symptoms, and we've been well below that since actually throughout, well below. In August, we had a little bit of a spike going up, but now we're back down again. Next slide. And then this is our testing, our weekly positive and negative. So the red line on the top is our negative numbers of testing, and this is testing for everywhere. So this is inpatient, emergency department, the respiratory evaluation center, and asymptomatic. And again, the respiratory evaluation center are for people who have COVID-like symptoms that need to have a doctor's visit and have a test done as well. And then our negatives are in the blue down below. So this kind of speaks to, we are actually doing fewer tests now as well. As you can see that overall red line going of it's really the summary of the two, but that our overall testing is going down. And so our positivity rate has gone up a little bit from 2.6 up to 3.1. And again, Josh had mentioned that if you do fewer testing, sometimes 1 or 2 positives will increase your positivity rate. So we're not that concerned about that increase at this point, but we'll be looking at, and we do need to continue to do more testing. Next slide. And that's it for me. I just wanted to keep it brief today. Thank you.
Thank you, Josh, and thank you, Dr. Levin. Is there any questions for either one of our presenters, Josh or Kim? I don't see any.
Markey, I'd ask a quick question.
Go for it.
Greg here, just Josh, regarding the response in the Latino community, how the case numbers have just dropped to 0 for a period of time. And I want to make sure, is our outreach the same? Is the communication the same? Is there any trepidation about reporting symptoms that have been noticed or measured? Are people still being forthright with their communication about having it? I do hear occasionally that some people are saying they would never tell anyone if they caught it, and that would include the entire community. Just looking at when the curve flattens out completely like that, it made me wonder.
Yeah, Greg, that's a good question. So we have seen the time it takes from when somebody first develops symptoms until they go get a test decrease. So for a while, we were concerned about that because it was taking people 3 to 4 days to go get a test. We have seen that decrease. So that's a good sign. In terms of, I think about a month and a half ago, we talked about, if people were being forthright with information that they were sharing with us when it came to contact tracing. We have seen some of that recently where, there are individuals who, have not been forthright with sharing information with us. And so we have seen some cases come from that. And it's not that, if we had known about it earlier, they wouldn't have been infected, but it could prevent a new generation of cases had we learned about it earlier. So, all that information is still extremely important, and it's really important for us to have that information really early on. But I'd say that, it's been a handful, right? It hasn't been every single individual. We've gotten a lot of compliance and, agreement from a lot of individuals, but it has been concerning because it has happened again. And for a while we felt pretty good that wasn't happening. But in regards to other types of communication, I think it's probably about the same. I just think, we saw a Labor Day spike, right? We saw people travel here from other places and, they brought COVID with them, or, they were in larger groups of individuals and they spread it to everyone else. So, or not everyone else, but several other people around them. So I think it's really, unfortunately, it was expected that we would see this increase. And, I don't know if it was really due to any sort of lack of communication. I think it was more so just, it was a holiday.
Thank you. I think it's important to note for the community that we have had pretty good compliance then with the contact tracing and reporting. And I think that's important to get out so people are encouraged that they can do that.
I totally agree. Thank you, Greg. Any other questions for Josh or Kim? Okay, if not, we're going to move on to the director's report. Karen?
Markey, and I just have to give a disclaimer that I have 2 cats that are about to get into a fight. So if you hear that, that's what the background noise is. One is outside and one is inside. So I wanted to give the board an update on the enforcement measures that we are working through as far as the notice of closure that was given to Scarlett's Restaurant. We are in the process of working with our attorney's office to set up a hearing, and that hearing has a tentative date of October 1st. And that hearing is an opportunity for the management of Scarlett's, owners of Scarlett's, to present, any information that we would need to hear from them is in relation to that closing. So it's an opportunity to hear from the establishment, and then also for us to share information that we have in regard to the reasons why we issued that notice of closure. So I wanted to let the board know that we're moving forward with a timeline around that, and we'll continue to keep the board informed as we move through that process. But the hearing is the next step in this in our strategy, I guess, or our process. And I'll stop there for questions before I move on.
Karen, are we seeing any other issues around compliance with the public health order other than what we've seen with Scarlett's?
So I would say that there's kind of 2 different components. There's the big overarching Pitkin County public health order that is in essence aligned with the state public health order. And we have a process in place with our education and compliance team. So really trying to help businesses, get their business safety plans in place, giving them guidance and education on how to do best public health practices within their establishments. And that's that's really the goal, is to really focus on that education and prevention. There are sometimes places where we have to look at a little bit more compliance, and our first step around that, and if you remember our flow chart that we shared maybe a couple months ago, is really to send a warning compliance letter. So if there are places where a business might be struggling with following the public health order, we really like that to be an opportunity to share, here's a place where you might be struggling with social distancing, and to give them that alert system. And so we have a couple of those warning compliance letters out right now. And then really, we really want to, that would be the goal, is to get to that place where we can work with businesses at that point to ensure that they understand what it means to follow the public health order, and give them the support around doing that. And so right now we have a couple, like I said, a couple warning compliance letters out in regard to places, more small scale things that might be happening within a business. The other place that we really look at education and compliance is around the isolation and quarantine orders. So those are also public health orders. We always send a letter to folks that might need to isolate or might need to quarantine. And that's just really a heads up of, here are the steps, and this is the process for isolation and quarantine. And then it feels like there might be some misunderstanding about what that really means for an individual or folks that have been direct contacts with that individual. We actually send out a public health order, which is just a different form of a public health order to ask them to go ahead and comply in a little bit more of an enforcement realm. And I would say, to Josh's point, there are some folks that are probably struggling with what it means to actually isolate or what it actually means to quarantine, and are going out and about in the community when they have tested positive for COVID-19, or they've been associated with someone who has. And so we really, again, try to go down the road of education and helping people understand the importance of, why you would want to isolate, why you would want to quarantine, and to ensure that we're not spreading disease and potentially impacting someone else's health. So we have a little bit of a compliance piece around that too, that we're working through.
You want to move on in terms of any other questions for Karen? Let's move on into transportation. This is
Sure.
a very important topic after the RAFTA board meeting last week. And I know, Karen, you've been working with our RAFTA leadership. So can you take it from here?
Yeah, we just wanted to give, again, a heads up or update to the board that RAFTA is coming out with a new RAFTA procedure and policy, and that they're bringing it to all 3 public health departments in the region that they touch. So Garfield, Eagle, and Pitkin, and that we're in a process of reviewing those policies with them, and helping them to think through best public health practice. And I've mentioned it before, but I'll say it again, that RAFTA is really a great model for our community. They've been stalwart in their ability to really think through complex situations, public health situations, while still really trying to honor their mission and serving the public. And they've just done a fantastic job, and they continue to really put the forefront of their employees and visitors and residents, everyone kind of at the forefront of how they frame the work that they do, and really thinking about the health of the community while still providing an essential service. And so we're in the process of just going through that review with them and supporting them in that.
Greg, you sit on that board along with myself. Any comments from the RAFTA board? And thank you, Karen, for that update.
I think George Newman, I may be listening in as well. He's the primary member on that board from the BoCC. But thank you for that, Karen. I think RAFTA management has been really impressive in their ability to care for passengers and riders. Of course, the challenge that I always talk about, and we talk about, is how do we increase capacity on the buses to decrease the traffic on the highway? We've kind of taken a huge step back in terms of traffic numbers, and they're working on that diligently, and they're coming up with some creative ways to increase capacity while maintaining safety. And we'll be hearing more about that. But I thank you for mentioning that, and we'll hear more from them, I'm sure.
Yeah, we've got a long way to go with RAFTA. Their goal is to increase capacity, recognizing we're only a few months away from going into ski season. And how do you deal with a lot of skiers and putting them on buses and crowded buses? I know they will continue to honor social distancing and wearing a mask, but still it's a challenge to try to figure out how we're going to move people around. So we look forward to the report, Karen, from you, and also from our RAFTA leadership as we continue to solve the problem. Okay, then we have...
And Markey, if I could real quick, just to say that, of course, RAFTA will be part of the conversation about winter. How are we gearing up for winter? And there's certainly a huge part of that conversation. So we'll be hearing more fairly soon, I think.
Yeah, I think so as well. I know they're working very hard with SKICO and our Public Health Board, as well as EGO and Garfield. Moving on, we've got schools. My, I tell you, I think our Aspen School District has done some pretty phenomenal work getting some of these smaller kiddos back in school. But with that said, I'm sure all of us are reading the articles about what the school board is thinking. And with that said, Karen, I'm going to turn that over to you.
Sure, and I think I just want to express the relationship that public health has with the school district and as well as with the independent schools. And we look at our role as consultants and ability to bring data to the table so that they can make the best decisions that they can. As the superintendent and the school board have that ultimate kind of responsibility on their shoulders to determine what model of learning they would like to have. So whether that's hybrid or in person or online, whatever kind of scenario that they're working through, and that our job is really to help with the public health aspect of this. So providing the chronometer data or allowing for discussions with case investigation and outbreak. That's a public health role with the schools. And we've been working with them around ventilation systems and really thinking through that. Thinking about screening, symptom screening in the schools. So there's a very specific public health focus in working with the schools. And so I just want to be clear about that we're advising and consulting, but we're not telling schools to open or close. That is for the school board and for the superintendent to determine. So with that, we've been working really closely with all of the schools, independent schools, as well as the school district, to really think about, well, what does it look like to have best public health practice? And I think they're doing a really great job at thinking about infection control. So that's, environmental things that you can do within the schools to reduce disease transmission on surfaces. And we have been working really closely with them around case investigation and outbreak guidance and what that would look like, in a school setting. The fact that they've done cohorts of 10 or under is really impressive. The way that they've managed that with the current in-person learning is really critical, because what we've seen just even recently with some of the high schools that have had to really have really strong isolation and quarantine for students is that their cohorts are really big. So if you divide a cohort out and there's 450 kids in a cohort, then you're shutting down, in essence, that whole cohort, which is a pretty significant impact to the learning of that school. So the fact that they have really small cohorts is super helpful in regard to reducing and keeping those social bubbles intact. So Josh, I don't know if you want to add anything additional, but we have a school task force internally to really help all those best public health practices, and they come together to think through what does ventilation look like, how can we help the schools in getting to the model that they would like to get to, and then we work directly with school leadership as well. So Josh, do you want to add anything about the relationship and how we've been working with schools?
Oh, Josh.
Karen, this is Kurt. Josh, we had a couple things going on, so he may have had to jump off to address something. So sorry about that.
That's okay. If there's questions, I can certainly answer more.
I don't see any questions. So let's move on into our next topic, which is the director's report. And Karen, I'm going to turn it over to you. And I heard the kitty cats being really happy with one another.
Oh, yeah. Sorry about that.
I think it's adorable as they try to kill each other. But anyway, okay. Go ahead, Karen.
Okay. Lindsay, can you go to the next slide, please? Okay, so actually that was pretty much, I just wanted to give you those updates on different things that are happening. And we'll go into more detail about some of these other things, about some of those topics later in the meeting. But we did want to turn to laying the groundwork for what we're anticipating demographically in the community. And that, you know, we've been talking about planning and preparing for winter season, and recognizing that there's a diversity of different aspects to the ecosystem. So whether it's, you know, skis on the hill, or it's transportation, or it is restaurants, or you know, all the different facets that go into a successful winter season that we all want to get to. We thought it would be helpful to just paint the picture of the, you know, what we're anticipating for a surge in the community around numbers, and how that would potentially impact some of the mitigation strategies that public health is looking at, as well as how does that impact and help inform planning. And I know that, you know, many of you have been in the community for a long time, and there's a good sense of what a winter season looks like. But I do think that this year, you know, might have some nuances to that. I know one thing that we heard from restaurants over Labor Day, and folks that were maybe having some challenges with capacity, is that they just didn't expect the number of people that they saw, you know, over Labor Day holiday. You know, I think there's a perception that we're going to see a downturn in maybe folks coming to the community, but that's not actually, you know, necessarily what they experienced over Labor Day, is what we heard. So do we know if things are going to be different? That's what John's going to talk about here. So I'm going to turn it over to John to just paint a picture of for planning purposes.
And I am going to confess to being a tardy student. I'm wondering if I'd be allowed to share my screen. I have a few additional slides, including this one. So give me just a second here. Are you all seeing my screen? Yes, okay, great. So I do not have the pretty graphics on mine, but I wanted to share a little bit of additional information with all of you. And so, as Karen said, when we're going through the airport planning process, one of the things that became important was understanding what was happening with population. And one of the exercises we went through was estimating what our total peak population is. And so in addition to looking at things like census data, which would tell us our population is just under 18,000, we looked at total jobs, commuting patterns, number of housing units over time, the average housing vacancy rates, to get a sense of how many were occupied by full-time folks, how many were available for part-time residents or VRBOs, that sort of thing. We looked at overall Roaring Fork population trends, skier days. We looked at utility usage like influent flows, water usage, average occupancy, including our traditional hotels, but also VRBOs, Airbnbs, and utility usage. And this is going back to the graph that Karen had up, was we came to components of peak population. And when I say peak population, this is the maximum that would come into our community. And this is typically over 4th of July weekend, but I think it's instructive in terms of the population that we're actually asked to manage in our Box It In strategy and mitigation efforts for COVID-19. And so these are based on 2018 numbers. I looked up 2019 census numbers, and it is 0.11% higher, so not a significant change in these. They're probably pretty similar. But you can see the components. Full-time population remains the same, whether you're in low season or peak. Commuters, so these are going to be largely the folks that are commuting into the community for work. So at low season, we have about 6,000, just under 6,000. peak season, about 8,200 commuters estimated coming up. Our overnight accommodations, low season, you can see we peak out, and again, these are peaks during low season, 6,000, peak out at 17,000 in high season. And then part-time residents, again, roughly 4,200 estimated in low season based on vacancy rate analysis, 10,000 on peak season. So you can see total low season, our effective population on any given day during low season tends to peak out at about 30, just over or just under 34,000 in Pickens County, just over 53,000 in Pickens County. And you can see though that there are some differences. Summer tends to be a little bit different. And so we wanted to look forward because we're going to be coming into our winter season and trying to give a little bit of a projection for context again of what is that population we're actually managing in our box it in strategy. And so we can see peak lodging population, all things being normal in the summer months, is typically just over 17,000, a little bit less, not a lot less in the winter, and then of course drops off quite a bit during low season. From a capacity perspective, we actually have more capacity than we're using, and this is important to know because even at peaks, it does tell us there may be some excess capacity in the community if we have isolation or quarantine kinds of situations, which is going to be important as we analyze what capacities we need to have for the winter. And that excess capacity is estimated, at peak times, right around 4,500 units in the winter. I'm going through this kind of fast right now, but again, in terms of monthly average occupancy, this is 2016 to 2018. You can see July is our big month, followed by August and September. So I think we can look a little bit at what happened in July in relation to what might be happening in our winter months. You can see November and December tend to have a little bit lower average occupancy than July and August. And then January, February, those are really consistent and collectively our most busy months. And so these numbers will continue to be revised, but to just give some estimates of peak winter populations as we're looking at populations that will likely have to manage. Still using the 2018 census population. Like I said, it's only changed by 20 people going into 2019, which is our latest numbers. So that wasn't terribly material. What I've done is based on the first set of estimates that we did, just put out a percentage of that peak for the winter for low side estimates and high side estimates. Again, I would think that these would be subject to change or some margin of error. We're all trying to take our best guess at what worst and highest level
John, I think you froze. Oh, John. Whoops.
I think we've lost him, Markey.
Yeah, I think he probably realizes that by now. Someone sent him a text. Whoops. Okay. Well, I'm sure he's trying to figure it out. Karen, do we want to go on with the agenda and wait till he comes back in?
Sure, and I don't want to put Kara on the spot, but if Kara, I don't know if you have the, oh, there he is, he's back.
There's John. Okay, John, unmute.
John doesn't have a cat. I don't know what it could be.
Can you guys hear me now?
Yes.
So please tell me that I didn't just give that whole presentation. You heard none of it.
We heard quite a bit of it.
Oh, good.
So your last slide was the peak winter season and July season.
Okay, so right here, we're really looking at kind of a range of.
You want to share your screen?
Oh, am I not sharing screen?
No.
Good Lord, everything went south on me. I apologize.
Okay.
Are you seeing the screen now?
Yes.
Okay. My apologies. Our internet has been temperamental today. So basically what this slide shows, and is kind of the upshot, is right now kind of low and high estimates for what our peak population. And again, this is peak population, so only be what's hit probably a certain number of days during the winter. Would be anywhere from 44 to just under 51,000. That's with our commuters. Our commuters typically live in other counties. When you take the commuters out, you have a population of visitors, part-time residents, and full-time residents ranging between 38,000 and 43,000. And you can see your midpoints here. So what's the point of all of this? The point of all of this is that typically when the state is looking at us in terms of metrics, and we're typically looking at a denominator population that's equal to our census population. You know, whether that's 17,747 or 17,767, which is our most recent number. But the population that we're actually working with in terms of testing, case investigation, contact tracing, isolation and quarantine, and capacity is a much larger population than that, more than double the census population in terms of the capacities that we're dealing with, and also how success of our efforts should probably be measured. As we look at the denominators that are typically used, it's in this 17,000 range versus these larger numbers. And as we are in our major seasons, we're managing to the larger population. So that's something I know the board has taken into consideration. We had talked about managing to a population of 39,000, so we're still in that ballpark. You might recall that in our earlier presentations, but we're going to need to continue to monitor our capacities to manage these larger populations during particularly the winter months as we try and have a successful winter season. So it's just about context. And I will give up the screen unless there are any questions.
Anybody have questions for John? John, how does this jive with the Destametrics that comes from marketing and tourism departments?
Yeah, so a lot of this was actually derived from Destametrics Destimetrics data, but there's also another database tapped for the vacation rental by owner, Airbnb, that sort of thing. So it's a combination of all those data sources.
Could I ask very quickly, John, just regarding our relationship with the state and how they count our population numbers? Do we have to make a pitch to them regularly that we, first of all, our second home population might be changing. Our part-time residents, we expect might be becoming more full-time, some of them. But how do are we getting the love from the state that we need given these larger population numbers that we're contemplating now?
That should be a really easy question to answer, Greg, and I think it's probably a little bit more complicated. So we have raised this issue with the state many times in terms of the population. I think as we go over some of the metrics in the new state's coronameter, what you'll see is that the census population is still the population being used, but they've loosened up how they are looking at it's not the positivity rate, I'm not using the right language, Karen, but how the number of positive cases per 100,000 moves you between levels. Sorry, what's it called?
The incidence rate.
The incidence rate, thank you. And so what you'll see is they've put a much broader range in the incidence rate in terms of how that moves us between levels, particularly for smaller communities, which I think was an attempt to address the fluctuation in populations for smaller rural resort regions.
Okay, thanks.
Are construction workers included in the commuters?
Yes. Yeah, it's an estimate of commuting patterns for all jobs, Dr. Kurt.
Other questions for John? Okay, Karen, I'm going to turn it back over to you.
Okay.
And Lindsay, could you go ahead and pull up the other slideshow? I think John has to take his down.
Yeah, I'm trying to figure out how to, it won't let me take it down.
Oh, great. There. So we wanted to talk a little bit about what's been happening at the state level and how that intersects with what we're doing locally. And there's a number of different places where we're finding that we're having to navigate differences between what is happening at the state and then what is happening here on the ground. And so there's a couple of different places that we'll walk you through. But the first is really what's happening with the state around ski, in particular ski industry guidance, and then what's been happening locally. And so and then the other, I'll just do the overview slides there. The other place that we'll walk you through is really our local coronameter and the measures and metrics that go with that. And then also the new launch of the state dial, which is like a state level chronometer. I'm really talking through the differences between those two systems. And what we'd like to do is, when we try to think about planning and the different public health practices of planning, we really are in this place where we have to make some decisions in the next couple of weeks of how we want to work to our unique community and really think about community, local control and community-based decisions here, as well as what's happening at the state. And we don't want to get into a decision today with you all, but we'd like to share with you some information so that when we come back in 2 weeks, we would be asking for some guidance from the Board of Health around a couple of these pieces. So Next slide, please. So this is just to give you the process. So right now the state, and this is particular to the governor's office as well as the Colorado Department of Public Health and Environment, the state health agency, and they are looking at convening a small work group of different rural resort communities. Every community that in essence has any kind of ski resort, whether it's Sunlight or Aspen Skiing Company or Vail Resorts, sort of the plethora of all the different kind of models that we have in the state of Colorado, and really looking at convening different voices in those communities. So local public health, county commissioners, other folks from the community. We, John, I believe that your request up to the governor's office was to include members of CAST as well as other ski voice in those meetings, but I don't believe that you've heard back yet. So right now, the process is that the state is going to come out with guidance at the state level sometime in October. And that is going to be driven by this task force and helping to create that. They really want local communities to have the flexibility of creating our own local plans, but they may have some overarching guidance that we will all be required to follow. We are also working in direct contact with Aspen Skiing Company ahead of the state guidance, because we recognized that we didn't want to wait for that to come out, and really crafting a plan together with Aspen Skiing Company. And what we also know is that there's ancillary sectors that are involved beyond just skis on the mountain. So thinking about restaurants and transportation and lodging and all the things, Greg, I think you mentioned earlier. So what we know is that we don't know at this time if the state process will lend to guidance or if it'll lend to requirements or recommendations. We don't know where the state's going to land on that. But what we do know is that the local plan, so Aspen Skiing Company's plan, has to be approved by the local public health agency, and then that it's submitted to the state health agency for final approval. So right now, that I just, again, wanting to share the process with you of what's going on around planning. And then also just as a FYI, because we are really trying to hone in on the box it in strategy and what does that look like for the winter tourism world. And what we do know is that the state expects tourists to pay for resources themselves if they are required to isolate or quarantine longer than their stay. And if those folks can't cover the cost, that the county will be responsible for covering the cost. And John alluded to this, but really looking at saving some capacity in the lodging industry for isolation and quarantine. We don't want lodges to be fully booked and then not have a space for people to actually stay longer than they might have originally planned. So that's just one little nuance, but I think it shows the complexity of what we're working through right now. Next slide. And then, so actually I'll stop there and just see if there's any questions. So again, wanting to share the process with the state and then what's happening locally.
Greg?
I apologize for capitalizing on the dearth of questions here and taking them. So if anybody else wants to chime in, please do. That last slide, I had not heard just that the state would expect the county to cover the cost of hospitalization or the resources put toward the tourists if they are getting sick. I think we need to dive into that at some point and do a deep dive there, because imagine we have 1,000 cases or 1,000 people get sick. What would that do to our county budget if we have to pay the bills? And I think that we should also be discussing on how to create an insurance policy for that if we haven't already. Whether it's a fee that goes on the hotel bill or on the ski lift ticket, but how are we going to ensure that we'll be able to care for these people if it comes down to us? So I'm just going to put a red flag on that because it makes me very concerned. That's an unlimited budget item right there, I think.
Yeah, and Greg, I'm not sure if it's necessarily related to like hospitalization, but it's certainly related to isolation and quarantine. So if someone had to stay for an extra
At
14
the
days.
at the Little Nell in the presidential
Right.
suite, room
Yes.
service.
Yes. Yes.
I'll take the hospital.
Yeah, and I do know that this conversation has come up at CCAT, the Colorado counties acting together, and this is of particular concern. And so, Greg, since that is a commissioner-led group, I do think to elevate that, to continue to elevate that conversation in that group would be really helpful.
Other questions for Karen? If not, Karen, you want to proceed?
Sure. Next slide, please. So this is the other place where we're, I just think in some ways we've gotten ahead of the state, which is not a bad thing. You know, we wanted the coronameter to be a way to share data with the community that we hoped would be helpful for the community to understand a lot of different metrics and a lot of different ways of thinking about where we are as a community as far as risk. And so the team spent a lot of time putting together some really robust metrics, both kind of the current state metrics and also forward-thinking metrics that that really tell a true, I think a really true picture of the community. So we listened to the community and recognized that the community really wanted to have understanding of what disease transmission might look like in our neighboring communities, knowing how we're also interconnected. So these metrics included, you know, what is happening in Garfield and what's happening in Eagle. And spent some, like I said, spent some time and have launched that, you know, recently, that the community is aware that that coronameter is out there. The state, I think, really liked, there were a number of different counties that did coronameters, and the state really liked this model. And so put together a task force, and John was able to serve on that task force and created, in essence, a dial system based on the coronameters. Through that process, we just got the launch. I think we got the launch about the same time as the community did, and there were definitely some pieces that we noticed that were really different from our coronameter. And so I just want to go through these as very high level kind of differences, but again, I want to frame up the conversation more on this probably, John said, like a meta level conversation of, you know, how do we want to move forward when we know that the state now has this dial system. In 2 weeks, we're going to have to make a decision on, do we keep our coronameter or do we go with the state dial system, knowing that there's, you know, complexities when we have two different systems and two different data matrices that we're working through. So overarchingly, the state system is really linked to this, you know, a dial, but it's also linked to the measures that associate with each level. So we won't go through the intricacies of all of those, but you can go to the state website and check those out. But they have the Protect Our Neighbor, which is the system that they had long before this dial, and that's still there. And the metrics for Protect Our Neighbor are different than the dial metrics, just to acknowledge that there are more metrics to get into Protect Our Neighbor than the dial system. And that's because at that point, they really want to look at a robust kind of data, robust data to really get a community into Protect Our Neighbor. Then we have a cautious level at Safer at Home. We have a safer at home concern level. We have a safer at home high risk level. And then we do have the stay at home. So this again is the state. So there's 5 different levels at the state. Our coronameter actually has much more than that because we've broken down the colors and had, you know, you might remember we had you could be at one space in the color, you could be in the middle of the color, you could be at the far edge of the color. So we had more spots that you could land on in our coronameter. Each level is defined by metrics and capacity limits. So we'll talk a little bit about that. They're basing their dial on 3 metrics, and those are the new cases in the community, a 2-week incidence rate, percent positivity, a 14-day rolling average, and then the impact on hospitalization. So are hospitalizations stable, or are they declining, or are they increasing? So 3 metrics. We have a total of, I believe, 8 metrics. So we had, like I said, more robust metrics for our chronometer. The county really is able to move through the dial system by meeting the metrics that the state has put out for 2 weeks, and then in consultation with the state. So if we are able to meet those metrics for 2 weeks, we can submit and say we want to move within the dial, and then we have a conversation with the state health department of whether we are able to move or not. I'll pause there and see if there's basic questions about that before I move on.
Any questions?
What about the October the 1st being in 2 weeks, which will be a day after we go into the new phase? So to anticipate this better, don't we have to meet in September?
Sorry, Tom, I didn't hear all of that. Can you say that again, please?
If we meet in 2 weeks, that will be October the 1st, which will be after the September 30th expiration. So don't we need to meet next Thursday?
Oh, in regard to the expiration of the public health order? Yeah. We can certainly talk about that, Markey. Maybe we can put that on the planning at the end of the meeting.
I've got that already written down. Okay.
Okay.
Okay. Any questions regarding this state? I like ours better. Agree.
Karen, are you asking us to give you a thumbs up or thumbs down on how to proceed with adopting the states, or abandoning ours, or staying with 2? I would advocate for simplifying by having one system, but I'm open to further argument.
Sure. So ultimately, I am asking that question, Greg, but right now I want to talk through a little bit of the pros and cons, and then I'd like to have that decision actually at the next meeting, not at this meeting.
Okay.
And the reason for that is, first of all, we want to see how our 2 meters kind of sync up together, and we don't know that yet. So it's sort of validating the state's information, and I'll go through a little bit more of the pros and cons. But we wanted to bring it back. I wanted to bring it back to the public health team as well, so that we can come in whenever we meet again and have some recommendations for you all.
Great, thanks. I didn't mean to rush it, just wasn't sure what we were trying to do. Okay.
No, thank you for clarifying. So next slide, please. So I talked a little bit about this, so I won't go through too much detail, but again, you can kind of see the differences between the kinds of metrics we have, a little bit more robust. We have a lot around disease control. So looking at test turnaround times and speed of contact tracing, because we know that those are really critical to that box-it-in strategy, and we wanted to acknowledge that that helps control. It's a mitigation strategy that actually helps control for disease spread, and so we had those in our metrics versus the state that just doesn't have that maybe as detailed of or robust of data. The one thing that is the same is the positivity rate is the same between the two meters. Next slide. Oh, okay, you can go back. Sorry, Lindsay. So ultimately, there are pros and cons to moving overarchingly to looking at these meters. One thing, as I mentioned, is that we just want to see the state data and how it plays out with our data. We want to make sure that the state's calculating the rates in the same way that we do. So that's just a little bit of a validation process. We also have, this, as I mentioned, ties to measurements. So as you go, and Lindsay, I don't know if you could flip to one of those slides that actually has like a safer at home. It's probably way down in the slide deck. Okay, thank you. So you can see, and I'm not going to go through the details of these, but you can see that every level of the state dial has then measures associated with it. So very similar to ours. And honestly, most of them are matching up with ours right now, but that would be a change as well. So if we went to the state dial, we would also be completely adopting the state measures. And again, these are a floor for us regardless. We always have to meet the state standard, but we can always be stricter than the state as well. And that's where we've had a little bit more latitude in having our own measures associated with our own dial. So if we did move to a state system and got rid of our own chronometer, then we would be in essence adopting all of the measures that go with that. And we wouldn't, we could potentially look at if we needed to be stricter, but we would just want to think through those measures as well. And then Lindsay, can you go back? Thank you. You're doing such a good job at navigating this. So can you go to the next slide? So ultimately, we do want to talk about this at the next meeting. The other thing that I want to bring kind of at that meta level, so we would be looking at adopting the state dial. We would be looking at adopting the measures that go with that dial. The other thing that we could consider is, do we want to adopt the state public health order? There are some pieces, we've been trying to align with the state public health order, and there are some pieces that we feel like are really valuable to keep locally, and we'll talk through that as well. But that's that meta conversation of sort of how do we want to move forward. And so ultimately, these are kind of the frameworks that I've been talking about. So if we were to go and really hone in on the state dial, if we were to really hone in on the state public health order, and if we really honed in on the state measures, does that free up the community to focus on other things? And I'll just use an example. So the team, the state puts out guidance. We've had really specific local guidance. Sometimes we had to put out guidance because the state didn't have any guidance. And so we created our own. And then the state would come out with guidance after, and then they would change their guidance. And we, some of our team members would spend hours just trying to compare the guidance between the state and local guidance and making sure that they aligned. Is that a good use of time, or would we rather be spending our time working with the restaurant industry and really helping them to understand the state guidance and giving them support and education around that guidance, rather than trying to spend all this time kind of aligning our efforts with the state? So that's just one example of an advantage to going with the state. A disadvantage of going with all of the state pieces is that we do lose that local control to a certain extent. We lose a little bit of that uniqueness of tailoring things to our community that are important to our community. And we may, we really do push the policy piece off to the state. So then the state is creating the policy for our community. Again, we would always have the latitude to add something or to be more strict, but it really is putting that policy piece to the state, and that we're doing the mitigation pieces and prevention pieces. And by what I mean with that is that we're doing prevention and education. We're supporting our community around understanding what the state's doing, and really helping them to comply with the state orders. And so that's just I think there's pros and cons to that. So I wanted to paint those out for you all. And again, not to make a decision today, but just to understand the context of what we'll be bringing to you in a few weeks. And can you go to the next slide, Lindsay? So probably already painted this out for you, but questions about that? And what can we do to support you in having that conversation at the next meeting?
Any comments there for Karen? Any questions? Seems to make a lot of sense to pick this back up in 2 weeks. And by then the staff will do a comparison side by side between the state and local control. As far as I'm concerned, just to really think about it, and while we've been able to expand our public health team, it seems as though when Karen has to work through a change or an update to the public health order, it takes hours and hours and hours. And is that time better spent on doing the 5 things listed here: prevention, education, mitigation, suppression, and enforcement. So we'll pick that conversation up in 2 weeks. I'll see if there's any other comments.
Markey, I just had a question for Karen. If we do go ahead and follow the state guidelines, is the variance process still in place? So if we do determine locally that we wanted to, say, change the busing capacity, would that still be a possibility?
Great question. And so what they're embedding in this dial process is called site-specific variances, and truly that's kind of what it is. So an example is that the Denver Zoo has a site-specific variance. So it's specific to that site, and it tends to be around large capacity events or large capacity settings. And that is the variances, that's the variance process that will move forward with the dial. And team members, feel free to pitch in and clarify what I'm saying if I'm not explaining that exactly correctly. But so they'll have a variance process, but it is really unique to size event, like large event size or large structure size, like the Denver Zoo, or I know like Glenwood Springs Pool has a site-specific variance. So you can imagine, that's how they're getting more folks into that setting.
And Karen, if I could just add in for context, the purpose of creating the statewide meter and metrics was originally to get away from the variance process, to have some consistency across the state, consistency in both how communities are measured in terms of their mitigation efforts, but also some consistency in what those mitigation efforts were going to be. Because when it changes county by county, we've seen the challenge with that communications wise. So the state was originally trying to get away from variances, to be honest with you. And Karen told me about the continuation of some of the variance process that came up yesterday as a task force member. I was very surprised. So I think the state is still going to try and limit the number of variances. In relation to some of the services that you're asking about, like transit and such, I think particularly for ski communities, those are some of the ancillary services that the state is looking at with that stakeholder group. And so we have a little bit of uncertainty going forward there, what the state's going to do.
Can we maintain parallel systems? Can we maintain parallel systems for a few months to be certain that it's going to work instead of abandoning the state all at once?
Good question. Karen? I think you have to pick one or another. But Karen?
Yeah, I mean, it's a question my team is trying to wrestle with, Tom. What we will ultimately do is we will continue to keep the metrics that we have established. And so whether that is, more forward facing through a chronometer, or it's a back end kind of the metrics that we feel like are really valuable for us to better understand what's happening locally. 3 indicators from the state, I don't think paints a full picture of what's going on for us. And, maybe that is okay to tie to these measures of capacity, but I don't think it gives us a full picture of what we believe, we want to better understand in our community. So more to come on maybe an answer to that, but I think that we will continue to collect those metrics regardless, and have them, maybe just on the data dashboard, because we think they're important. We just, again, how we're calculating information and how the state calculates information, sometimes we have to work really closely with the state to say, well, why is your data showing it this way? Our data is showing it this way. And that's a lot of kind of conversation that we tend to have when we have 2 different kind of dashboards that are out there.
And Markey, can I add on to that? Because there's really two elements with the corona meter. One is the metrics and how the meter moves, which Karen was just talking about. And then the other piece is the mitigation measures, the public health order side that's associated with those different levels. And one of the things that you all are going to have to wrestle with is the metric side, yes, but also it can be confusing for the community to be getting two different messages about what's allowed to be done. And we end up spending a lot of time then trying to explain that versus, as Karen said, just really focusing our efforts on prevention, education, mitigation, suppression, so on and so forth. So that's going to be, I think, some of the questions that you all are going to have to wrestle with. When these broader questions about how do we align. Tom, I would imagine that we're going to keep tracking some of the data, because as a committee member, I was surprised when it came down to the 3 metrics, because there were a lot more metrics, more similar to what we're doing here in Pickens County in the original model. And they're important information and continue tracking. We've got to though wrestle with, how does our community interpret this, and where do we want to spend our time? That'll be the tough part.
Greg?
Thanks, John and Karen, for this. So we've got the next 2 weeks to contemplate this, and I'm hoping that that's what our board is going to do for the next 2 weeks. So when we get to this meeting, we'll have some thinking will be put into it already. One thing that occurred to me is that really the confusion comes from having 2 different dashboards, 2 different speedometers. And a man with 2 wristwatches never knows what time it is, right? So I'm wondering if we might be able to take the model that the state has created and then modify that locally. It'll look the same, but maybe the needle isn't in the exact same place, and we explain why very simply, but we keep the graphics similar. So when somebody checks in with a dashboard, wherever they go in the state, they're going to see the same thing, and it will be familiar. Maybe they come to our county and the needle's in a slightly different place, and we have our additional metrics, but for the quick visual checkup, it's similar to the states, so there isn't any confusion. And I noticed the last time we looked at this, the states was actually, the needle was moving a different direction. It was going left to right instead of right to left. So it looks like we are coming into some sort of coherence with them. But I would just suggest, is there a way that someone on our team can come up with a way to use their graphic, but maybe add our spin on it as necessary, but with the object of making it simpler and easier to understand for any visitor coming here from other places in the state?
I agree with you, Greg. I think we should have the same reporting language to the state. So it's not like speaking Chinese to a Russian. It should be the same reporting language so they understand us.
Right.
Question, Markey?
Yeah, Tori.
Thanks. On first blush and just hearing this, my first reaction is that on the con side about the ability to tailor it to our needs. So as we get towards next 2 weeks, could we get a little bit more information about what the impact of this is? I understand it, one, on the measurement side, and but as it affects stages or regulations and requirements, could we get a little bit more information about that? It's been an interesting 6 months with the state. I think somebody was pointing out that, oftentimes we saw that the county was moving forward with some regulations soon to be followed by the state. Maybe then the state was changing. And so I haven't necessarily thought that all of the state actions and regulations were as relevant to our community as maybe I would have liked some of them to have been. So as we go towards that next 2 weeks, could we have a little bit more information about what the real effect or impact of aligning with that state with the state is, and obviously not aligning with the state on those 2 items gives us that flexibility. So just a little request for more information, please.
Sure, and we had one of our staff members do a crosswalk between the two systems. And so it's a big, large spreadsheet, but why don't I share that? And then you can all see the differences and similarities.
That'd be
Thank
great.
you.
Yeah, it'd be great because we all need to prep for the meeting 2 weeks from now. Okay, Karen.
Lindsay, go ahead and just go to the next slide, thanks. Okay, so one thing that we kind of missed in this piece is that, you know, we really know that moving forward, and now that we're in kind of a different stage of response around the pandemic, you know, how can we really have these intersections with the community? And we've done a lot of sector specific work, so working, you know, closely with RAFTA, or now working with SKICO, but really thinking through, you know, the advantages of engaging with the community and having more bi-directional conversation. You know, early days in the pandemic, it was a lot of decision making happening really fast and not a lot of people giving input into that because we needed to make decisions quickly. But really knowing that planning for a successful winter season, it takes the whole community to do that. So I'm going to turn to engagement with the community. And Jordan, I'm not sure if this is you, but just wanted to make sure. Yeah, great.
Thanks, Karen. So we just wanted to take a minute to really talk through the mechanisms that we have in place to be engaging with the community. As Karen mentioned early on, we kind of have this business liaison team, and we're very reactionary. We're coming up with guidance. We were trying to get businesses open, and there was a lot of one-way communication. Now that we've all had a little bit of a time to think about how things have gone and how we want to move this work forward, we've really transitioned from this business liaison team to really a community liaison team, recognizing that some of the things that we're going to be able to focus on going forward really falls into these 5 categories of relationships. So as Karen mentioned, increasing that two-way communication with these kinds of specific sector outreaches in ski industry, transportation, lodging, restaurants, schools, as well as kind of one-on-one relationships that some of our subject matter experts are continuing to engage in, relationships that are made with our consumer protection team, going out and visiting these businesses, explaining the guidance that exists, being available to answer questions. And then I think the other area that we're really wanting to move into in this relationships and being seen as a resource is knowing that folks from the community liaison team, which is made up of subject matter experts, as well as consumer protection team members, as well as representatives from our communications team, are able to join other community conversations that are going on. So the City of Aspen and ACRA are putting on these amazing open houses for the community to say how it's been going. They're doing it with businesses as well as with the community in general, and we'll have, you know, someone from our community liaison team be able to be there and answer questions. So, you know, as we go forward, we really see the role of this team being able to use the existing guidance that we have. That's going to be a huge time saver, that we don't have to be researching, developing guidance. We can be explaining it. We can be working with the community. Where there isn't existing guidance, we can be doing that research. So we do have the expertise on the team to be able to do that. Most recently, we've been continuing research around masks, effectiveness. We've done HVAC systems. Tom Dunlop is on, if we've got time later, to talk about the research he's done into using tents in the winter to expand capacity. So continue to have that research ability, especially if we are not having to develop guidance all the time. Communication is the next step there, alongside with education. So knowing that we can help to facilitate this outreach to the community, as well as being a part of other events that are happening as the community liaison and public health team with expertise in COVID, but knowing that we don't always have to be the ones convening the meetings. We are happy to help participate in the community work. And then education and compliance tend to really live with this consumer protection team. And Brian is going to talk a little bit more about the work of the consumer protection team, how they're really out there doing that outreach with businesses. And I will take a minute just to let folks know that we, in this new transition to the community liaison team from this specifically business liaison group, we've got a new email address. So if you've got a question, you can always send it to us, and we will respond to you. So it's communityliaison@pickenscounty.com.
Great, thanks, Jordana. So yeah, I just wanted to really briefly mention that the consumer protection team is not just out here to do enforcement, that we are really here for education. And we feel that this flowing season, off season, will be a great opportunity for us to go out into the businesses when they're not so busy and have these conversations and be able to review their plans and processes and make sure that they have a good understanding of what the expectations are for the winter as far as table placement for restaurants and capacity limits and everything in between. And we're pretty well experts on the public health order and those requirements, and we are happy to come out and talk with anybody that needs some help so we can catch any issues before they become actual issues when we're nice and slow. And also as part of that, we have begun doing direct communication via email to specific industries from who has sent in business safety plans. And we just recently sent an email out to the restaurant group, just thanking them for the summer operations of really trying hard to keep this county open and safe. And also to mention new updates from the state that allows pool tables, which was very exciting for a few different places, with some new guidance that goes along with that. But this was the first opportunity we had to be able to try this system out, and hopefully having more direct communication with to the specific industries will be more helpful than a broad-based attempt at talking to every single person in the whole community about things that may only apply to certain people. So that's what we have going on right now.
Okay, next. Karen?
Go ahead. So if there's any questions for Jordana or Brian before we move on, and
I don't see any questions or anyone's hand.
next slide. And I think we can skip over. So we already talked about this, so let's go to the next slide. So Jordana, I'll take this one and then we'll see if we have time for the rest. So there are some places as we move forward in this thinking around completely adopting the state public health order, and in essence, really thinking about what are the key critical things that we might want to have locally. And the things that we've identified, and we're open to, this is where we really want the board to come back with thoughts as well, is that we really feel like the mask ordinance is a critical piece. And so certainly the state has just extended the mask ordinance for another 30 days, I believe. But we know that even within the state measures, mask requirement will be a really critical part to the success of disease containment. And so we feel like if the state decides to lift the state order, that we would want to keep a local mask ordinance in place. So that's one piece. And we embedded in our local public health order the requirement to submit those business safety plans and event safety plans. And we feel like that's really helped us to when we have had to take enforcement measures, having that embedded in our public health order has been helpful, because those are really, it's a, you know, an agreement between the organization signing that business safety plan and public health that they will follow their business safety plan. And they're the ones that are crafting that and deciding for the hows. We're just telling them the whys behind the public health initiatives for that. So we would like to consider that if we went to a full state order and didn't have a local order anymore, we would lose the ability to have those tucked under the public health order. And then right now, just for your situational awareness, we are more restrictive on the state around events. And we'll talk, I think this is an opportunity to talk at the next meeting further about that, and a little bit about some of the tweaks that we're making to the current public health order. But that's probably the place where we have the biggest difference with the state. And go ahead and go to the next slide, please. So let's pause there. Jordana, I don't know if this is an opportunity to talk about just the tweaks that you're currently reviewing around the public health order, and then we can come back to this one.
Jordana?
Karen, I just have one question, if I can. Would you clarify, I'm just a little confused between the difference of adopting the state plan, making that decision, and the dial and the state chronometer. Are they one and the same? Are they two different decisions? And if we adopt the state corona dial, if we start moving between different levels and there's public health orders attached to each level, does that mean that when we're on that level, automatically that public health order is enacted in our county, whereas a different county would have a different public health order?
Yeah, it's a great question. So I'll just use, I'll use Garfield as an example. So Garfield doesn't have a local public health order. They just go to the state health order. So for the state metric, we have to comply with the state dial and the state measures, right? That's always, we have to do that. We can be more strict in what we want to do. And so if we want to be more strict in capacity or suppression kind of strategies, we would have to have our own public health order, because that's the way that we have more stringent requirements in our community. If we fully adopted the dial and we said we are not doing our own chronometer, we are going to fully adopt the measures that the state has, and we're not going to have our own measures, more strict measures. And the option is to fully adopt the state public health order. Does that help? They're kind of...
That helps. So it's a package deal. So if you accept the dial, we're accepting the orders, and we have no option to make it more restrictive.
We always have the option to make it more restrictive. So that's...
Even if we adopt it. Okay. And then what if we bounce back and forth? Like I'm looking right now, we are in safer level 2. And so all of the public health orders behind safer level 2 is where we would be. What if in 2 weeks we went down to safer level 1? Would that mean that our orders would shift in 2 weeks? That's a confusing part of it. Are they attached to where our overall status is, and are they different by county? Because it can shift in a week or 2, right?
Yeah, and team, feel free to jump in on this. So this is why I think this is why it's going to be really difficult to have 2 different systems, because the way that the state system goes is that if you are to shift, you know, in the horizontal way, so you're going from one level to a more restrictive level, right? Because the metrics are showing that you need to move in a more restrictive fashion. The way the state process goes is that you have 2 weeks to work with the state. You have maybe an extra week to do mitigation. And if you can't work through that mitigation and get your numbers lower, you're automatically pushed into whatever those measures are in that level. Is that answering your question, Kim?
It does, thanks. It just seems that it would be very confusing to when you're moving between levels to automatically have a public health order that moves with that. And so it would be kind of a constantly shifting public health order. Anyway, I didn't want to take up more time with that. I just wanted to clarify.
And so that's, I think we need to get more clarification on that. So if we use a county that doesn't have their own public health order, what does that mean? Because the state public health order is incorporating the dial into their, into the public health order, the one that just came out. But I don't, and Jordana, you may have a clearer sense of this. I don't know how that then manifests itself because the state's not shifting their public health order, right? They're not saying, because it's county specific. You know, counties can be at different places. So Jordana, you want to weigh in on that?
Sure. So the state's order has all of the different levels within it and refers to the dial that puts you into the corresponding requirements associated with your level. So the phases, as we've said, each have associated metrics and requirements and guidance that go along with them. And when you move to a different level, which the process has described how that happens, it's not immediate. It's at least you get 2 weeks to know that you may be moving to another level. And then once you're in that level, all of those measures are prescribed. I think the other area that I'd like to just reiterate is that no matter what we decide locally, we always have to be at least as strict, as restrictive as the state. So anything that we would be looking to do would always have to align with the requirements that the dial lays out for us. And then the only options we have are to be more restrictive than those.
Okay. Karen? Who's going to be speaking about state level travel restrictions? I think we've lost Karen. Jordana or?
Karen, sure. Larissa has done the research around these. So Larissa, okay. If you're on the line, I'm wondering if you can pop in there and just give the high level of what the advocacy letter outlines and what we'd be asking the Board of Health to support.
Sure. So based on the discussion we had about traveler restrictions, I think the consensus was around to kind of have more of a comprehensive approach to these traveler restrictions and supporting not only one, but maybe various different strategies. So I did put together a letter that I'm sure Karen will share with you all, but it did include support for those different restrictions that we talked about, such as health screenings, health declaration forms, the mandatory 14-day quarantine, visitor testing, and visitor education. And the way that I kind of supported those strategies is really looking at what other states are doing, which we discussed before, but more specifically, really looking at Maine and what they're doing, which is a very multi-layered approach with these traveler restrictions, which has obviously been working because they actually have the lowest positivity rate in the country right now at 0.6, I believe. So, and they have required testing, and they have required these compliance forms for visitors that all lodging accommodations require visitors to sign when they arrive. So they've really engaged the community in several of these strategies and created a really effective multi-layered approach. And so that's really touched on in that letter. And so the other component of that letter is really keeping those tourist economies functioning by ensuring that visitors that are arriving are healthy when they get here. So that's kind of the overarching components of that letter, and just wanted to inform you all, and hopefully you'll be able to review it and we can get support and send that up to the state for consideration.
Thank you, Larissa. Does anyone have questions for Larissa? So Larissa, I do have a question for you. Do they tell people from some of the, like the Florida and Texas, that they're not allowed to come into the state, or do they allow them going into a 14-day quarantine and with testing prior to arriving?
Maine specifically is not basing their visitors on that, like, you know, high risk states such as Texas or Florida. There are states that are doing that type of strategy. Maine specifically is just requiring that you show up with a negative PCR test at least 72 hours before arrival. If not, then a mandatory 14-day quarantine. And either or, whichever you have, whether the negative test or you have to comply with a mandatory 14-day quarantine, you are required to sign a certificate of compliance that you either have that negative test or you will quarantine. And as I mentioned, they've kind of engaged the lodging community to be able to help increase compliance around that.
So there is a letter that has been prepared, correct, Larissa?
Correct.
Can we get that out sooner than later, because we are less than 2 months away from the mountain opening?
Absolutely. I'm sure Karen might have an update on when she'd like to share that with you all.
I don't know where Karen is. I think we've lost her.
Yeah.
I came back.
Oh,
Go ahead, John.
okay.
But I missed some of the context. So John, if you want to weigh in, I just finally popped back in.
Yeah, so actually, I believe Karen sent out a notice to get that letter out. So it should be either linked to you or will be linked to you soon. So that was the letter, Karen, to the state.
Yes.
Are we finding other counties willing to send in a similar letter, or no?
I have not had that conversation. Karen, have you had that conversation with your peers?
I have had it with some of my rural resort peers. I don't feel like there's a super high appetite to sign on to that letter right now. I will now that we have it composed, I would like to bring it back to that rural resort group and ask them, especially the one, we have a group that's convening specifically around winter tourism. I think we had Jordana through Tori's connection had been working with CAST. And Jordana, if you want to do a quick update on that, I think there was some interest from CAST perspective.
Yep, there was some interest. I can follow back up to see if they would like us to come and do any kind of presentation to that group.
I would anticipate, just like expressed at our last meeting, that a quarantine requirement can be difficult, right? It can have a chilling effect on tourism. So as long as there is an out, that negative test, symptom-free kind of piece before coming into the community, and typically that would only be enforced, obviously, on the back end if you're symptomatic and test positive, end up in isolation and quarantine. Did you follow these steps before coming in? It has less of a chilling effect then on people visiting if there's an out, like a test ahead of time.
Yeah, I kind of like the idea if you don't. John, you had that experience that you drove your daughter to school, test required.
We barely made it in our time frame, but we made it. But yeah, we went and we went to Massachusetts, which had the same, I think, requirements, or very similar requirements to Maine, where we had to fill out a visitor traveler form, which was on the state's website. And then we had to be able to produce proof that we had a negative test within 72 hours of entering the state. And so it was easy enough to accommodate, and we were never checked once we got there. But the state would have had a record at least of our contact information and such if we were part of a contact tracing.
Thank you, Jim. I think that is a great way that we probably should be going. Okay. Anything else, Jordana or Karen, relative to state travel? You'll get that letter out so we can all take a quick peek at it. Okay. Okay, next item, Karen.
Markey, do you pardon me for jumping in real quick regarding this letter to CAST and this letter to the state. I think it would make sense to me to have some understanding of the financial consequences if the state is putting the financial liability of a quarantined traveler onto the county. I think we should have a prediction of what that could actually mean financially for us. And I also wonder if part of there's the carrot and the stick with the traveler. Get tested 3 days in advance and be prepared to present that to us, fill out the declaration form, and also maybe sign a form that says they understand that they are financially liable if they get stuck here and haven't followed those rules in some way. I'm just wondering if we can provide incentive and a disincentive from breaking the rules here. I support the rest of what I'm hearing, but I'm really concerned about the financial liability aspect. And I'm wondering if we can help use that to incentivize visitors to do the right thing.
And Larissa may be able to comment on this, Greg, but I know other states have certainly required those types of disclaimers that if you end up in a quarantine situation, you will be responsible for the cost if you're visiting a community. I don't know, Larissa, if you have more specifics on that or not.
Yeah, like you said, I think that is something that other states have been doing, is adding that disclaimer on there, and I think it would be very beneficial to have on there so that they are aware of those associated costs if they do have to quarantine or isolate. And I don't know if that's something that, Greg, you're maybe talking about also on the local level, assuming that, you know, we don't know if this is going to occur on the state level or not. But assuming that we are going to require visitors to cover those associated costs, it might be a good disclaimer form for us to have locally as well, just to consider.
I think that's a great suggestion. Thanks for bringing that up. I also think it would be smart to have some of our money-minded, you know, our accountants, people who can predict these things, our economists, determine what are we looking at with some scenarios. What could this actually end up costing the community if we have an outbreak, for instance, of some size? Just a thought that it'd be great to know what we're in for if we're going to follow or agree with the counties or the state's rules regarding financial liability. Whether we have a choice or not, I don't know.
Just curious, is this anything that we can put in our local public health order as a county and say, this is our rule here, and then it would fall back on that, so it didn't have to be something that was signed for each visitor or agreed upon?
Jordan or Kara, we talked about that earlier today. Do you want to bring that up?
So it's always an option for us to put things in our public health order locally. So currently right now in the state order, there's some wishy-washy language about visitors may be required to pay for their lodging if they need to stay to quarantine or isolate. We have recommended putting the definitive language in our public health order. And so that's one step we can take. And then I think even more importantly is how we're getting that word out to folks who are visiting. And then to a point Karen made earlier, also working with our lodging partners to make sure that they have capacity for people to continue to stay if they do need to stay longer to quarantine or isolate.
Markey, thank you for elaborating on that. And I think that's an important conversation, and it's going to require more time than we have today or probably in the next couple of weeks. We did speak earlier about planning for winter with the restaurants and the industry people in the town. And I don't know if we're going to get to round robin to discuss that today, but I think it's super important that I think Karen talked about reaching out to the restaurant community with our team. And then we'll have a report at the next meeting. Is that still the plan?
Karen?
It is, Greg. Yeah. So I know Jordana made connection with some restaurateurs today and are scheduling out that meeting right now. And we'll come back to you at the next meeting with a team to share that information.
Great. Thank you.
Okay. In terms of looking at where we are on the agenda, ski planning and update, I think we've covered that, have we not? And looking at anticipated winter travel, do we want to go deep dive more into that, or did John's presentation earlier provide us with the information that's crucial? Karen?
I guess that's back to the board. Lindsay, if you want to go to the next slide. Yeah, so that we don't have much more to share around that.
Yeah, we're kind of all over the agenda right now. But anyway, I hope some of you had the opportunity to read the white paper that Tom was very much a part of authoring. And with that said, let's take a look at this. Tom?
Thanks, Markey. Yeah, the restaurant industry has obviously been hit extremely hard with the coronavirus, and are searching for ways to recover, especially with this winter season coming on. So there's been conversations recently about expanding seating, which would improve the revenue stream for many restaurants. And the seating limitations currently on identified spaces in existing restaurants is pretty limiting. So there was conversations about erecting tents next to or attached to existing licensed restaurants. And on the surface, it really sounds like a good idea. It became clear to us, though, that we needed to identify fatal flaws or boundaries that might present some difficulties. And the intent of the review was to provide information to the restaurant industry, not taking a position of is it a great idea or not a good idea. So we looked at the criteria of the food service licensing, which is through the state of Colorado, and what restrictions they might have on tents being used as food delivery venues. I had a conversation with the Colorado Department of Public Health and Environment, and also talked to the City of Aspen Environmental Health. The state of Colorado does the inspections in unincorporated Pitkin County and the town of Snowmass Village, and the City of Aspen Environmental Health Department does the inspections in the city. So talking to the state, the Colorado Food Code does not prohibit a licensed restaurant from expanding dining into a tent, but compliance with the code, I was made very clear to me that compliance with the code is not negotiable. So if someone wants to put a tent up next to a licensed facility currently, and all they want to do is serve food in the tent, the state does not have to be involved. This being said, diners could order off a menu. They could have staff take orders, serve and bus tables. Diners can place an order and go pick it up themselves and return to their table. And then after consuming the food, the diners leave and the staff does the cleanup and disinfecting. So that would not require the state engagement at any specific level. However, if any, and the emphasis is any food was held, prepared, or stored inside the tent, then the state would require a plan review, licensing, and inspection prior to the allowed use. So this is as simple as having an ice bin used to replenish drinks, holding tables, temporary bar, buffet service, and so forth. So the state food regulations are not prohibitive. They just have to be, there has to be a careful attention paid and conversations with the establishment owner, with the inspecting agency. Tent safety was another thing we looked at. We had a discussion with one of the Roaring Fork Valley's largest rental companies who gave us about 35 years worth of experience. These were experienced rental comments being offered to us. The tents are primarily designed for the summer or 3-season use only, not necessarily in the winter. If they are used in a cold environment, heating inside the tent must run 24 hours a day for comfort and convenience of the people inside the tent. This was interesting. The large tent rental cost varies between $5,000 and $7,000 a month. And then you have the heating costs to go along with that as well, which can be quite expensive. There really isn't an easy way to mechanically ventilate the space inside the tent when the sides are down, which would be a wintertime use, obviously. And the circulation of air inside the tents is mainly for heating purposes. The aerosol study that we did in the past, maybe a month or so ago, that we did when aerosol distribution of the virus became important to consider. The air circulation inside tents is going to be quite cumbersome and unpredictable. So we would, the unknown would be the important realization that aerosol spread could in fact happen with somewhat of a haphazard ventilation system. Snow load was a concern. Again, this is from the tent rental companies. They always have concerns about the buildup of carbon monoxide and off gases from the heating systems. The kind of a final comment that we got from the person we interviewed was that he was concerned that people are going to create dangerous situations trying to make a tent do something that it's not made for. The other important conversations that have to happen that we did not do, but we'd be certainly encouraging the industry to follow through on, would be talking to for fire safety, talking to the fire marshals in the city of Aspen, the fire departments, the town of Snowmass Village, for the building and zoning, looking at their locations of the proposed uses, and then conversations with the community development departments in the city of Aspen, Pickens County, and town of Snowmass Village to see if there are any land use codes that might have to be addressed in order to have the tents go up. So using the tents or similar structures to enhance dining in the interim during development of a more long-term and sustainable response to the spread of COVID. And again, we're always looking for a vaccine, just really needs careful thought. So why don't I stop there? This is just information to the industry that it's not prohibited, but there are certainly some things that the applicant would want to investigate just from the cost and the safety and compliance standpoint before renting, when I know there's inquiries, a number of inquiries being made of the tent suppliers in the valley from people who are interested in doing this. And I'm not sure, they may have already done this type of investigation, but if not, this was the intent of this review is to provide a kind of a background for them to take the next steps.
Questions for Tom? Tom, just a question that comes forth. In reading the white paper, and I thought very carefully about the tent safety, particularly around the issue of snow load and fire safety. And we've had some experience here in Snowmass Village hosting JAS Labor Day. And we really had to not have any fire inside of a tent. And I'm thinking about these heating elements inside of a tent. And to me, I think that's a huge safety concern, which you pointed out. And of course, we need to get our fire marshals involved. But second of which is just thinking about the HVAC in these tents, it would appear to me inside dining might be far more safe. Could you give that some thought, Tom?
Sure. Obviously the safest dining is going to be outside at this point, but that's not a consideration in the winter except for the most hardy. But indoor dining is obviously the safest compared to what we discovered in our review of using tents for outside dining. There are a lot of complicating factors, and it's just important that if someone is interested in this, that they do the due diligence and not just throw something up and expect to increase their seating and revenue by creating a situation that might not be the safest. Again, the food code can be worked with easily. That was good news. It's some of these other factors, the codes and the tent safety, that we discovered were going to be perhaps more problematic. But in an established structure that has a ventilation system that is incorporating filtration systems and designed airflow, social distancing of tables is going to be a safer environment.
Thank you. Do I have any questions for Tom? Looking down the list. Greg, you can go ahead.
Yeah, thank you. I'm getting embarrassed here. I'm the only one asking questions, or not the only one, but I want to make sure that I'm not taking anybody else's time. I appreciate the research on this, looking into it. I do want to put it in context that I worked in the film business for many years, and it was practice to put tents up all manner of times and places throughout the seasons and operate safely. I know our construction industry is using tents safely all the time when they're building buildings. Yes, there probably are incidents and we should be incredibly vigilant about it, but we're not inventing anything new here. And I want to make sure we don't err too much on the side of restrictions. And we really encourage, of course, we're going to demand that people follow the rules and follow the codes. But I don't want this to become so restrictive that we've just ruled out an option for keeping a winter economy going. I'm very, very concerned that, it would be very easy to say, oh my God, this is just too dangerous. When the fact is we've been using tents and doing things in tents back since the teepee. And so I just want to put that in context. Thank you.
Well, I appreciate that. And yes, I hear what you're saying. I think the challenge really is going to be some of the fire safety issues. So,
Yeah,
Markey?
Greg, this is Tom. I'm sorry, just to follow up on Greg's comment. Please understand that it was not the intent to dissuade, either encourage or discourage the use of tents. It was simply a matter of raising the issues that someone should do diligence before they make the investment.
Great. I appreciate that. Thank you. And hopefully we can help people do that and give them some guidance. So I do appreciate what you've brought out.
Tori?
Markey, the city of Aspen has got a lot of our resources going to reaching out to these restaurants. We've had a lot of conversations, a lot of input collected. There's a lot of different variations of a tent out there that people are talking about. I'm just wondering from you, Markey, what are the conversations up in Snowmass Village? Do you have restaurants that are looking into tenting ancillary space?
Absolutely. And I know SKICO is looking at tenting as well as an option for providing dining services as well. Now, was there any change today? Heck, I don't know. I didn't get a chance to talk with Clint specifically about this. So I'm sure we're going to pick it up next week or 2 weeks from now at our work session.
Okay,
So
I'm just wondering how, you know, some coordination. This is the Public Board of Health meeting right here. We have the BOCC. You have Pickens County Public Health. The city of Aspen, as I said, is putting a lot of energy into this on the ground right now. We have a business town hall next Wednesday at 9 a.m. Where this is sure to be a discussion as well. So I'm just wanting to make sure that we are all are coordinating on these efforts.
Right, and I think this is a question. We do know that Jimmy Yeager is the lead spokesperson or the liaison for the restaurant industry, and I'm pretty sure our Snowmass Village restaurants are participating in that endeavor. So I will look forward to seeing some recommendations coming to the board in 2 weeks around this issue.
Thanks.
Anything else here? Any other questions? I'm scrolling through. Okay. Karen? Or
Yeah, can you move to the next slide, Lindsay? That's what we've got for you all. So I think we're into round robin unless you have other questions.
okay. Moving into round robin. Oops. There we go. A round robin. What are you hearing? What are you seeing? What are you experiencing? And what type of questions might you all be getting?
Markey, I'd like to start on this if I could. This is
Krista. Go ahead, Krista.
Thank you. So I am a parent, and I'm also the part of the district accountability committee at the school district. And there's a lot of changes going on at the school district right now. We have a new superintendent. School's not in session for, school's online for a number of people. There's a lot of stresses basically going on at the level of the school district. And I think that it's reaching a point where a lot of parents are getting pretty frustrated. And I hear this when I go pick up my kids at swim practice, and I see people, and I think that, again, some of the feelings are that some of these people are the frontline workers. They've worked hard all summer, and they feel like life is just getting a little tough right now. So the one common theme that I really felt that we could make a difference with this has to do with testing. Because I really feel like some of the comments I heard had to do with people not having good access to testing, have to pay lots of money for testing they don't have, reading about other school districts where they are able to open more effectively because they have more access to more testing. People have brought up Mesa County, where they have, in the rodeo lot there, a free open testing site. Based on some person's comment, I actually emailed Dave Ressler, the CEO of the hospital, because there's some rumors going around that they had, had a donor help purchase a machine for extra testing. And I think, again, this is kind of the common theme that I'm feeling, and I just wanted to make sure I brought it up here and give these people a voice as well, because I think this is a concern that I'm hearing.
Thank you. Kim?
Can I jump in really quickly, and I'll let Dr. Lovin jump in as well. We're in conversations about testing in regard to CMC, Aspen Skiing Company, and I think there's an opportunity to loop in K-12 through maybe a synergistic relationship with an overarching testing strategy or testing a concrete testing strategy for those two other entities, and we just started those conversations. So I'd like to have the opportunity to bring that actually back to the board and to present that to you all. It just really started to have momentum literally like 2 days ago. So I don't want to, overpromise or anything, but we have some I think some pretty interesting potentials to share with you all.
And I just want to note some of those community test sites, like the one you referenced in Mesa County, those are actually state test sites, and we just haven't been successful in getting that type of resource here.
John, is there anything specifically we could do that would make us more successful in that?
Probably have a lot more people.
We did hear from Sarah Thunberg, who is really like the testing coordinator for the state. We just heard this the other day that those community-based testing sites aren't getting the volume that they had anticipated. And I honestly don't know if they're going to continue to have that as a strategy moving forward across the state. And that was just sort of an offhand comment she made. I'm going to dive deeper into that with her and find out what the success is, why they're having challenges and barriers. But to John's point, I think scalability is important. And if they're already seeing in other places which have bigger populations that they're not getting the efficacy of those sites, I want to learn more so I can share that back with you.
The other thing I really like about that one is that it's free.
Free. Yeah.
I'm sending people from here. I mean, my patients, I send them over there.
Yeah, and I just wanted to echo Karen's remarks as well, that we are, the medical advisory team that I work with is working closely with public health as well to try to increase testing in the community and especially in the schools. And we realize that it's really an important issue at this point, and doing our best to do it in a way that creates equity and access. So the cost issue is always a big issue, and just to create equity and access for school testing and the importance of keeping schools open and testing in that role. So it's really being addressed and work lots of different possibilities, and one that Karen has just discussed. So thank you so much, Dr. Giesel, for bringing that up.
Thank you guys very much.
Karen, just a question for you. You briefly mentioned SCICO and the schools system, and what was the third entity that you're working with?
Colorado Mountain College.
Okay, CMC. So as we all know, SCICO employs over 3,000 people every season. I'm thinking, and they're coming in from all over the United States, some of the worker bees, and some of my adopted grandchildren have chosen to do a gap year and come and work for SCICO, and they've already been hired. And I'm thinking about how are these kids going to get tested? Not only on an ongoing basis, but when they first get here. So I assume they'll have to come with a COVID test before they start going through the hiring process right before Thanksgiving. And when the second part of that is, I would want to make sure that the kids and the other adults, not all just kids, would have they would have the capacity to do testing on an ongoing basis.
And I don't want to presume to know what Aspen Skiing Company has planned, but they're going to be sharing with us some information next week about their strategy around this. So that's where we had this opportunity to learn from them and to see what they're thinking. And then is there an ability to kind of synergize maybe some of these other systems that we're learning about?
I really like that idea. Coordination, cooperation, and synergies are some of the buzzwords that we continue to need to remember. How about someone else in terms of Greg? I see your hand up.
I keep trying to pull it back. Thank you. I think I sent an email this morning just that detailed the way Manhattan, New York City, with, I don't know, is it 12 million people, is handling their free testing. Ubiquitous free testing is what it sounds like. And it does beg the question, okay, maybe it's time for us to revisit that. And yes, Krista, I have heard and spoken with people in the community who were willing to contribute to funding additional testing. That didn't seem to be the issue. It wasn't a money issue back at the time when they proposed it, and they still may be offering to help if we can see through to a way of doing it. So that still is on the table. One other thing I did want to bring up is that we had our CORE, Community Office for Resource Efficiency, board meeting this morning, and part of the discussion was that the retrofit that Jimmy Yeager is going to do on his restaurant is being advised or enabled in some ways by the resources that CORE has and their expertise with HVAC systems, filtration, ventilation systems, things like that. And at CORE, we're super concerned that this community is going to move toward putting in a lot of air handling and heating systems. And we may be filtering air and making things a bit safer COVID-wise, which is necessary, but we're also going to be increasing the community carbon footprint dramatically. CORE has means for helping us do this the right way. And so I'm hoping that they will be part of the ongoing discussions with the teams that are going to be reaching out to the restaurant and tourism community, so that when we do make retrofits and we do start erecting tents and putting up outdoor heaters and coming up with systems, that they are done in a responsible manner, looking at the bigger, longer emergency of climate change, which is easy to ignore during the pandemic, but still very important. So I'm hoping we can have CORE participate. They're willing to lend their expertise to the ongoing discussions as we prepare for a winter season. Thank you.
Thank you very much, Greg. Thank you.
Markey?
Yeah.
This is Kurt. Can I make a comment
Absolutely.
about Greg? One of this issue came up with the state health department and air handlers, and I've asked them to put out a press release on this. The epidemiology team in their biweekly calls that we have with them expressed a lot of concerns about a lot of these air handlers that they're getting information about are unproven. And so I just want to make sure that, if people are looking into these things, that we're not looking at items that are being promised to clean the air through unproven technology. And don't spend your money on things that aren't, because there's a lot of things out there. I think Tom's done a lot of research, and I think Tom and I even talked about this. So I just want to caution everybody about, before you really look into this, make sure you know what you're looking at and that it's truly a proven technology.
Kurt, thank you. And that did come up in our meeting as well. That was Mona Newton, the director of CORE, did want to clarify that they're not putting in something that's the equivalent of wearing a mask. What they're putting in filtration systems that take out particulates, but they don't necessarily eliminate the virus. Some of these things have ionic purification systems, and the ionic systems don't seem to be particularly, I don't think they've been approved by FDA yet in all cases. So there are certainly questions, and there are no silver bullets. But
right.
we're moving in the right direction, I hope.
Right. Well, and I know some of them are ozone generators, though, and so that was one of the comments specific with the EPI team, because we do not want ozone generators utilized in childcare or school settings, because those are pollutants, and we have some consequences to that. So again, I think there's just a more robust, and I've asked CDPHE, because they have a lot of background in some of this, to put out some press release so that we can get some more information out there.
Great. I think we look forward to the coordination as we go forward.
Tom Dunlop, you had your hand up quite a while.
Thank you. Yeah, Greg, to your point, I am working with CORE. I've had a couple of conversations with Mike Boucher and with Joni Matranga regarding the installation of a specific technology that's going into one of the restaurants in town. What we've been looking into is ultraviolet, a process called dry hydrogen peroxide, vaporized dry hydrogen peroxide, electric air filters, ozone, HEPA filters, MERV filters, air exchange, fresh airs, ultraviolet, far ultraviolet C. What we're finding is and what we're looking for as a public health department is the separation, clearly understanding the separation. The CORE is looking at it from an energy a conservation perspective, and we're looking at it from a public health viral load reduction perspective. But that doesn't exclude us from working closely together, which I have been doing with CORE. But we're looking at the Centers for Disease Control and Prevention, the Heating and Air Conditioning Engineering Society, and the State Health Department, as we're looking for third-party, independent, neutral evaluation confirmations, peer-reviewed data of the claims that are being made by many of these technologies that are coming out. There's a flood of money going into the industry right now, and we're just being very careful in urging people to be cautious and very diligent about looking for third-party independent confirmation before they spend the money to invest in something that if it removes VOC, volatile organic compounds, and it removes suspended air particulates, does not necessarily, may be an energy conservation point, but it may not do anything for the COVID. And I know some of the technologies I mentioned are representing that they do represent COVID-2 and COVID-19.
Great, thank you for that.
Yeah, Dr. Kurt, I saw your hand go up.
I'd like to comment on the necessity for physician referrals for COVID testing in Aspen. Because in New York or in Denver or in Mesa County, you can walk in as a self-referred patient and do such testing. And I think the necessity of having a physician referral in Aspen is sort of inhibiting the testing process. Could we have some discussion on that?
Cam? Or Linda?
Yeah. Yeah, thanks, Tom, for bringing that up. That has been a challenge throughout the entire pandemic, that a physician order is needed for a test. When there are systems in place in other, in public health testing sites where there's not a lot of interaction when there's a test result. There may be an email that you get, and then if there's a positive, your public health will contact you. But at this time, we have not moved to that, and it's still a requirement to get enabled to get a test. A lot of these tests, the lab requires a physician order, and for public health testing, for outbreak testing in our community, we've done a standing order under my name. So when the public health team feels that there's an immediate necessity to order like a handful of tests for an outbreak, it's under my name, and then they do the follow-up. But there's incredible amount of work with follow-up on test results. And it's very intensive conversations and follow-up work. So we're not there yet. Ultimately, that would be the best goal in terms of efficiency, but and we're hoping to head in that direction.
You know what Mesa, this is kind of back to my first comment though. This is what Mesa County's doing, and right, like they just, you can free, and if we had a donor that could do it, we could make it happen, except for I think this is the sticking point. We don't have the manpower to do all the follow-up, and the doctors that are in the community, it takes a lot of time, and then the doctor order allows that doctor to get paid for their time to provide that service. So I guess, do we know in Mesa County, is the public health department doing all the follow-ups for these people?
My understanding for the state-run testing sites, which John mentioned, the Mason County is a state-run site. There's a standing order from the medical officer for the state. And so the follow-up is not, there's not really any follow-up. I think it's just an email or you check it from an app and there's no conversations. What we've experienced here in this community is that the conversations on the test results are really intensive. There's a lot of questioning. There's a lot of, in terms of what do I do now? What does this mean for me? How many days do I need to isolate? Let's help calculate this. There's a lot of support that needs to happen. And so I don't think these people are getting any of that support. And maybe it's laid out in the beginning. You're not going to hear from a doctor. You're not going to have these conversations. And this is all you're getting. And so, yes, I think the intensive part of it are these conversations after, which we feel is an essential piece of the public health in addressing the public health, addressing the pandemic, and really addressing everybody's individual needs, and figuring that out. So we have all found that is a huge piece to testing, and you would lose a lot if you didn't have that. In terms of a client or a patient who wanted a test, it would be a very kind of non-personal experience, but and probably through an app to get a result. But anyway, that's the most efficient process, of course, and to have it free is another issue.
I will just say on that, my husband is a primary care provider here in town, and I feel like what I hear from him coming home is these conversations are so intensive, and just being a doctor that does work more down valley and with people in Mesa County, you know, and the corridor between here and there, like it's a different patient population up here. Like they are going to demand more of a physician's time than I think a person just getting a result. So thank you for your comments on that, Kim. And I think that is probably the bottleneck to this whole issue though.
Let's face the facts. You know, SCICO is going to have 3,000 people starting work in November. And what are they going to do for testing? They certainly can't do it with the individual physician referrals. Are they going to put a tent in the Buttermilk parking lot? Something's going to have to be to manage these 3,000 people starting work in November. So we can't skip over.
Yeah, I think that's, Tom, that's what we're going to be learning about from SCICO next week, is they have a company I think they're currently considering working with, and to learn more about what their plan is around testing.
Okay, thank you. Anyone else for round robin? Yeah, Linda?
I think that, you know, with those kinds of numbers coming up, that it might be like a health fair, only a coronavirus fair, where the people get tested and then have to go to different stations based on what the results are, and that these stations have to be manned by people that can give them the advice that they need to get before they are released into, you know, wherever they're going to be living and working.
Yeah.
So that might be something that we might consider with the large population of people that are coming into work, such as your grandchildren. You know?
Yeah.
Yeah.
Okay. Other people? Any other round robin? If not, let's talk about our next agenda and meeting time. Karen has proposed 2 weeks from now. Tom was thinking 1 week from now. Karen, what type of time do you and your staff need? You're planning just to extend the existing public health order for a period of time? Is that what your thought is, to allow us to do 2 weeks from now?
I mean, I think we had some minor changes we're making to the public health order that we didn't get to today. And we're planning, we could extend the order out a little bit longer, so that we can come back and revisit that in 2 weeks. I think for us, we know the state is looking at the data with the dial for 2 weeks. And we really wanted to give ourselves a chance to do that comparison and sort of validation of their data. And I don't know if we'll have that done in a week. It feels like 2 weeks might give us a little bit more sense of what that comparison is. So I am not sure if there's immediacy to meeting next week or not. Beside that, we have, you know, a order that needs to, maybe we can just extend it out a week or something like that.
That makes a lot of sense. Let's allow the staff to do their work. And by then we'll have updates on the winter season. We will have all seen the draft letter that's going to the state. Look forward to seeing that. We'll talk a lot more next time about restaurants and all the winter business. At SCICO update, I mean, it's going to be a pretty busy agenda, and Tori has his hand up.
Just as you referenced the letter that we were going to see, are we going to have an opportunity for input in that? I just am still unclear about, is that letter going to be advocating for a mandatory 14-day quarantine or not?
It has that piece with it with the caveat around the testing. So yeah, why don't we share the letter out with you and get further feedback so you can actually see it and give us some information before we confirm that. The other piece that we want to get to you is that crosswalk between the dial and the chronometer so you can see it side by side of the differences. And just as a heads up, we have some non-COVID related things that we need to bring to the board. So we can talk through that a little bit more, but I just want to bring that situational awareness to you that we have a OWTS fee increases that actually need to be approved by the Board of Health. We have also to bring a budget to you, which actually is also a statutory requirement that you review the budget. You don't approve it. It goes back to the BOCC, but we would like you to see that. And that is a piece we need to bring forth as well. So we'll figure out the timing on that, but just to kind of keep those things in the hopper, that we have some other actually non-COVID things to talk about.
Yeah, it's really something. We have to deal with budgets in the middle of all this. So there's a lot of heavy lifting that has to be done over the next month. So thank you, Karen. Greg?
Karen, I appreciate this. If we talked also about perhaps there's a way to simplify, if we adopt the state's meter, how do we adapt it so it really works for us as well? And I'm wondering if there are creative solutions for just a visual simplification. I just wanted to throw that back in there, whether or not we decide to go that way.
Thanks, Greg. Yeah, thanks for the reminder on that.
Okay, anybody else? Any other questions? Any other item for the next agenda? If not, I'll entertain a motion for adjournment. Tom,
I
thank
move
you. Do I have a second? I think Krista had her hand up, so thank you, Krista. All in support, raise your right hand. Thumbs up. Okay, we are adjourned. Thank you all so much. Thank you, Karen, and all of your wonderful team. A lot of great work. And Dr.
Thank you
Levin,
all.
thank you so very much. And Tom Dunlop, great report as well on the whole issue around tents. So thank you all. See you in 2.